here we are. So Andy asked me to do this, it seems, I think it was 2 years ago, but before everything that happened. And when I wrote this title, Health Protection, Prevention and Wellbeing, I had no idea, obviously as none of us did, what was coming. So here we are, and it seems even more appropriate to be having this discussion. And you know, I probably, like many of you, have been trying to avoid the news, just because it's so bad, and you know, she used the word toxic. So most of the time I listen to Jazz FM, but on one day this week, actually, I just, believe it or not, and I'm not going to digress off into politics, but I live in Saffron Walden, which is between London and Cambridge, beautiful part of the world. And believe it or not, our MP, Kemi Badenoch, suddenly was standing to be Prime Minister. And just to let you know that if anybody had asked the residents of Uttlesford what they thought of that, the first thing we would have said, well, who is she? She doesn't live in Saffron Walden for starters. She lives in Wimbledon. So anyway, I was rather curious in this rather bizarre situation to see how she was doing. So I switched over to LBC. And on LBC, Jeremy Hunt was on. You can't get away from politics, you see. And he was having a phone-in about what's wrong with the NHS. So I was thinking, let me get to Jazz FM quickly, please. But I decided I would just stay with it, because on the phone was a junior doctor. And Jeremy Hunt said to him, since the pandemic, he said, why is it that death rates are up and it seems the health of the population is worse than it's ever been? And I thought to myself, actually, I can answer that as an acupuncturist, and just what we've been seeing over the last 2-3 years. But interestingly, the junior doctor, I thought, made a very good comment. He said, because people's health conditions now are so complicated, and people have really more illness since the pandemic, and we all know how bad that's been for everyone, whether you had COVID, whether you didn't have it, the lockdown and all the rest of it, the anxiety. And so, you know, in a way, it seemed to me a bit of a daft question being asked, you know, why is our health so bad? But anyway, just that's really by way of really setting the stage for this. Let me just check so this is really what I thought we'd do today. I'll tell you a little bit about me and how I got to be an acupuncturist, and the rather unusual life and road that I've traveled the last 30 years. And then what I'm going to do is share with you a little gem of knowledge about how the Chinese actually understood the cause of disease way before we have the understanding we have now, because actually, particularly in the light of COVID, it just makes so much sense. And then I will try, and obviously stalked by uncertainty and the fact that most of my answers to questions about COVID is, I don't know. But anyway, I will try and just give you a little perspective from the acupuncturist point of view, and certainly what we've been seeing in the clinic for the last 2 years. And we talk a little bit about current trends, and if we have time at the end, because a lot of questions usually arise when we talk about acupuncture and health, if we can, we'll have 10 minutes or so just for a Q&A. So let me just go to, whoops, I think we've gone on too far there. Let me just go to the one I want. Nope. Okay, no, let's just stay there for a moment, that's fine. So, why on earth did I become an acupuncturist? I grew up in London as a kid, and then we moved up to Leamington Spa in the Midlands, and very beautiful town. And I think my dad always said, because he didn't want me to have a Midland accent, they sent me to a very wacky school, which was terribly lucky. It was the Kingsley School. And it was actually a gift from Charles Kingsley, the Victorian novelist who wrote The Water Babies, for his daughter Rose, who was a suffragette. And, you know, every morning our school motto was Esse quam vidari, and it means to be rather than to seem to be. And I think, really, if I go back, that though at the time, I was young, I didn't really understand it, I think over the years, that motto has become terribly important to me, and I realize probably explains a lot of why I took the journey I took. To be rather than to seem to be, not to question, not to take everything at face value and to question everything. And I can tell you it's made for quite a difficult 30 years, and certainly taking a road less traveled means that your view becomes very different from friends, from colleagues. And so there was something of, really having to stick by those values and be true to yourself. So I was in those days at school where you chose either arts or science, and I was always the one that wanted to dance and sing. But actually science was quite interesting too. Anyway, I did one of the very early mixed modular degrees in Southampton, which was actually English, media, and performance. And, Southampton University decided they didn't like anything to do with running a media degree because it's often been called a Mickey Mouse disease. But my goodness me, I more and more, and particularly with COVID, even with the heat wave we've had this week, I think actually everyone should be trained as to how to read the media and not to always fall into the hysteria that it creates. So I look back at that stage of my education as being really useful. Anyway, I worked for the Beeb for a bit, and I guess I was also lucky enough to be in that generation when we could travel. I didn't want to travel for the sake of it. And I guess I sort of decided, having worked in music and dance for a bit, that I wanted to do something that would just take me out of Britain and so on. Anyway, to cut a long story short, I learned acupuncture at the London School of Acupuncture and came out of there in 1989. And then I set off on a flight bound for Peking in 1990 and went and lived in Nanjing in China. Really where I did my postgrad in acupuncture. And what was so amazing was that I used to think when I learned acupuncture, is it because, I've got all this time with patients and they want to talk. But the first things I saw in a busy ward in China were shingles, which was pretty severe, and facial paralysis. And because the patients were coming to the hospital every other day, I thought, wow, something happens when those needles go in. We don't understand what, but actually the traditional theories are really very eloquent. So when I came back from China, feeling my sense of reality had shifted a bit. In China, the whole atmosphere in a room would relate to how your health would be that day. And so, I thought, don't want to come back and be almost like an obsessive here. You also have to live, So anyway, I set up a clinic initially on my own, and then I worked with a couple of colleagues. We set up something called the Birmingham Centre for Chinese Medicine. And really that was a bit of an experimental time through the 90s. We didn't entirely know what acupuncture could do, but we started to get really good results, particularly with pain and depression, anxiety, and so on. And anyway, at that time, because in order to earn money, I'd actually gone into teaching in my past incarnation of music and dance and so on. And because I had that teaching experience, by this time the acupuncture profession was beginning to move. And in order to professionalize, we felt the way to do that was to go into education and also to do the research and really to promote best practice and safe practice for the public. So in the early 90s, there was really a big search out for people who had some experience of education who could write an acupuncture degree. And to cut a long story short, I wrote an acupuncture degree for the University of East London and I set it up and run it from 2004 up to 2014. And so this was not the career I'd expected. My idea was really I would probably have some time in China, come back and really just stick with the art side of my life. So I'd never in my wildest dreams, me really with an arts background, thought that suddenly I would wind up in a school of health and bioscience. All my colleagues were scientists. I was rubbing shoulders with immunologists, and I shared an office with a cardiologist. And, you know, the lovely thing was that actually they were very pleased that we were there and what we were doing, because the acupuncture degree was a BSc, was actually really starting to add this sense of scientific inquiry, which as a child I'd always thought was pretty exciting. I mean, particularly in a lab where, you know, you have a Bunsen burner, and apart from not singeing your hair, you know, or blowing up the lab, actually you do something quite fun. And to really subject acupuncture through this process felt very rigorous as well, but yet we could be open-minded. So half my staff I recruited from China, and that was another issue, was that we could really build a bridge with our Chinese colleagues. Because remember, you know, China's political system, the way that they learn, there's very little criticality. So when you add our freedom here in the West with the Chinese rigor and this incredible medical system, you can really do something special. So I had a fabulous time at the university. It really was as good as it got with acupuncture. You know, students were beginning to investigate things like, you know, we discovered that the use of an acupuncture point on the back switched off the nerve that overstimulates the bladder. So really useful for chronic cystitis. We had a patient come into our university clinic with a panic attack, and using ear acupuncture, she went out calm, which was wonderful for students to see. However, there were then 5 universities in the UK running acupuncture degrees, but this didn't go down too well with certain quarters of the scientific establishment. And although this sounds like a conspiracy, it's totally true that a very angry pharmacist set up a website and a very vicious campaign, along with the Guardian journalist, really to get rid of acupuncture degrees and chiropractic degrees and homeopathy and all those so-called alternative things that had suddenly found themselves in the mainstream. And to start with, I rather ignored it. I mean, my view was, look, you know, you're an armchair pharmacist, that's fine, I respect you. You come and talk to our patients. You come and sit in our clinic in East London, and you look at some of the misery, and you look at what they get from acupuncture and this wonderful medical system. Anyway, of course, universities are political. Again, we're back to that. And my boss, unfortunately, left, the original VC of the University of East London. The new team were not as sympathetic, and so they were very happy to close us down, basically. And every acupuncture course in the UK that was in a university got closed down. So that was in 2014. But, you know, the strange thing, and my last 3 years were pretty horrid, actually, because I really didn't go to a university to be fighting political fires and, you know, going off to the House of Commons Select Committee to talk. I thought, this is really not how I want to be spending my time. So, but, you know, the good thing about it was, strangely enough, what happened was that actually by this time, the public really knew about acupuncture. And our evidence base was growing and growing and growing. So the audience, if you like, were there. I realized from our point what we'd been very bad at was we were not very good at communication. So, you know, when I talk to you about yin and yang and qi, and I tell you that if your kidney jing is weak, this could happen, or your liver qi is stagnant means you're too angry today, it sounds like New Age gobbledygook. And the trouble is that these are terms like qi, for example, that come from ways back. And the way that the campaign against us used these terms, of course, I realized made us look very silly, because yin and yang and qi, you know, well, what are these things? In science, there's no such thing as qi. And of course, when I used to teach first years about qi, I'd read them Taoist quotes, such as this one, which is that every death is a dispersal of qi, and every birth is condensation, and there's something about pulling in and letting go. And I've lost both my parents in the last 3 years, and I have to say, was with my mum when she died. It was beautiful just as that sort of, she was 94 with dementia, so it was a welcome release, but I really felt that she died actually in my arms, and I felt that sense of her chi just going. But, you know, if you use this language in the wrong setting, then, you know, apparently I'm a fruitcake, you know, who's off with the fairies. But in China, which is, you know, I mean, you only have to look at the political system of China. The Chinese are not given to expressing a lot of emotion, but it's all there in their medical system. And, you know, to me, that's a huge contradiction. I mean, I hate the political system of China. I think it's scary, particularly it's the first of the world's real cyber security states. And I think I've got Chinese friends and colleagues. What's happening there is quite scary. But, you know, on the other hand, you know, the medical system and the whatever's inside is quite wonderful and has a huge amount for our society to learn from. So anyway, there I was out of the university and pretty exhausted, I have to say. But anyway, I wanted to do some research very much around this problem we'd hit about communication. It was partly our responsibility that we'd almost grown too fast as a profession, but without having really sorted out how we communicate to a Western audience, and particularly the establishment, the medical establishment, the scientific establishment, what it is that we actually do. So I did a very interesting master's up in Cambridge on intercultural communication. And the professor running it, who agreed to supervise my work, said, do you know anything about intercultural communication? And I said, well, yes, I've been doing it for the last 30 years. You know, anyway, actually, I didn't know an awful lot about it. I didn't realize how, you know, really our cultural differences are terribly important in the way we express and receive wisdom. So, you know, when I look at acupuncture here in Britain, we've got different organizations with vested interests. So we have BMAS, which is the British Medical Association. They're the doctors. And I would say that they're pretty colonialistic. So whilst they know something happens with acupuncture, they know if you put a needle in someone's back with a disc compression that some of that inflammation will go down. But they don't want to know that that might be because the person has weak kidney qi or stagnation that's built up over a number of years. So they're very separate. The physiotherapists are kind of a bit under, you know, they have big hierarchy in our medical establishment. So, you know, poor old physios, I said, I don't know if there are any in the audience here, but I'm sorry if there are, because I really respect your work if there are. But, you know, they come under that with sort of, and they also, I think they know there's a bit more to acupuncture because they're very hands-on with their patients, of course. But everything has to be evidence, evidence, evidence. And yes, evidence helps us make clinical decisions, but it's not the whole story. And then there are Chinese, and I'm sort of doing this because, interestingly, we've all got in these separate camps. So the Chinese doctors here, many of whom are absolutely wonderful, very well trained, and really will make a difference to your health. But they've sort of set themselves up in their own Chinese circle, the Association of Traditional Chinese Medicine. And it's very funny, if you look at your website, it's very Chinese, what you'll see is a map of Britain, and they've got a flag in every corner, just true to Chinese kind of world domination. So, but, you know, much of our work is also to try and build bridges. And then there's us in the middle, members of the British Acupuncture Council, who I think sometimes, a bit like Britain can be generally, try to be all things to all people. But anyway, we've made big strides over the years. We've got a lot of support, even to the point that during COVID, we got awarded critical care status. Critical care status. I would quite like to have had critical hair status. It's, must have had too much wine last night. So critical care status meant that actually we could work through all the lockdowns, but more of that later. Anyway, so like everybody else, I then set up my own practice from home whilst doing this research. And then, of course, COVID came. And for the first time in all these years, I had, like everyone else, to close my business. which was rather strange because I had a lot of patients with very acute pain who really begged me not to close. But for the first time ever, our insurance was taken, so there was no choice. It's very nice. The council, I have to say, were very supportive. And I then went and had 16 weeks off in the sunshine, and as we know, in very weird times. And I actually signed up for an online American jazz piano course, and so I think that was actually very good for the soul. Anyway, we got this critical healthcare status, and then we reopened in July of that year. And I thought, what sort of clinic will I have? Will I have any patients? Anyway, they came through the door in their droves, and by the autumn, really working 10 to 12-hour days wasn't much fun because the need out there post the COVID lockdown seemed to be greater than it ever was. We never closed again. We kept going right through that dark January lockdown and right through and onwards. And now we really don't know what to do with all our patients. I have a second acupuncturist, and I'd probably argue at the moment that decision to close down university courses was really stupid, and it was stupid financially because at the moment acupuncture is so on the map. We get GP referrals, we get consultants saying, yep, try acupuncture. And the evidence base, if we're going to be just evidence focused, is absolutely fantastic. So at the moment, there are probably not enough of us to deal with the demand that we've got out there. And, we'll come on to a bit at the end. I have got no doubt that COVID, whether it's from, as I say, the lockdown, the health anxiety, the way the world's changed, having COVID, having a COVID jab, all these things have really impacted on our health. So. And we've sure seen that. And I feel if I was going to write a book, which I have been planning, which was actually going to be more around the causes of disease, I'd write it as a kind of, from an acupuncturist perspective during COVID of the kind of stuff we've been seeing in the clinic. But we'll come back to that. I just need to keep an eye on time here. So let's just shoot on to the next. I really want to share with you something that I learned a long while ago back in the 80s as a student of acupuncture, as to really how the Chinese think of disease causation. And we have to go back to thinking of people living in a time when they didn't even understand how the blood circulated. They didn't understand we had a brain up here, or kidneys, or a heart. You wouldn't be constantly taking your blood pressure because you can go to Boots and buy a blood pressure machine. It's really hard to get our mind actually back to this time. But anyway, the view always was that disease is always based on external circumstances, and really the dance between what's going on in your world, in the greater world, and our internal world. And it's those preconditions that sort of dance together with sometimes not good consequences. And one of my favorite books, actually, that comes from the 1980s is Ted Kaptchuk's Web That Has No Weaver. You can still get that book. It has the most profound introduction written about really the differences between traditional Chinese medicine and Western medicine. And I love his quote here, which is that it doesn't concern itself much with cause and effect, but it's the relationships and it's the pattern of events. So that's the key. And the title of the book, The Web That Has No Weaver, you think of a spider's web, and you know that, it's the way in which symptoms come together that is so important here. So, a few starting points. So, we always talk about equilibrium. I'm sure my patients always get, when they come back, what they get is me always doing this. And I guess the dancer in me, but this is our equilibrium, and it's constantly changing. It changes from night to day and from winter to summer. Weather conditions, whether it's damp, whether it's dry heat, which is something else we talk about. And the key is maintaining balance within this equilibrium. And the other thing that I think is so important, I really want to underline, is that what's good for one person isn't good for another. And so, we are not all the same. And that, for me, was one of the big problems about COVID and the way that it was dealt with. We are not the same, and we don't have the same health status. One size doesn't fit all. And so, you know, we all know that particularly in Britain, we have a pretty sort of, you know, a real exercise kind of culture, which is very positive on the one hand. But, you know, when I saw someone the other week who has got a shoulder problem, and she does, what's that, bag punching? You know, she does sort of like punching a bag 3 times a week. And I said to her, do you know, I think that's really making your rotator cuff muscle inflamed. You keep doing it, you've got to stop. And she looks at me like I'd asked her to take a trip to the moon. You know, just it's too much. You know, you don't need to keep proving this all the time. You could do something else. You could do something quieter. So, you know, it's... But then on the other hand, not doing anything at all. And I saw a lovely guy who'd lost his wife, and his love of his life was his dog. And then the dog died. And then he bends down, and then he twists his back. He gets sciatica. And, you know, this guy was in his late 80s, and when I saw him, he was in a lot of pain. He said to me, I've got nothing to live for, Charmian, nothing. He was overweight, he'd lost his mobility. He did actually die, sadly, in the year following that. But, you know, it's I mean, for him, it was his time. But you know, it was that loss of movement. It happened so fast that, you know, there was just nothing really left there. So, you know, those are rather extreme examples, of course, the kickboxing to someone actually dying. But anyway, and rest is very important in Chinese medicine. And I know when I first lived in China, we'd start very early in the morning and have a very early lunch at 11 o'clock. And it was a 2-hour lunch break. And then all the Chinese all the doctors, they'd all go to bed after that, like a siesta, you know. And of course, we Westerners kind of thought, we can't waste a minute, you know, here we are on the other side of the world. And so we're up doing things. Well, after a month, actually, I went to bed too at that time. And I realized that this rest was actually terribly important. So pacing ourselves. And, you know, my observation is that in this society, even when we retire, and we get older, there seems to be, we're always on the do, you know, we've always got phones and things going on, you know, so rest is something I'd argue we probably don't allow enough of, to really be still and to switch off all those signals. So one too many there. Yeah, important considerations. The Chinese always said, what you come in with is really important. There's a lovely book called, actually, The Tao of Pregnancy by Bob Flores, American writer, who looked at all the beliefs around ideal times to conceive that would affect the constitution. You know, don't ever conceive in a thunderstorm, or when drunk, interestingly. And so it goes on. But the health of the parents at conception was considered to be terribly important, as it would be today. Childhood weaning, I think this is a really interesting one. A lot of emphasis put on this, and I must admit, when I lived in China, the kids used to run around everywhere, and they did have a real freedom of expression. You know, I don't see so many dummies these days, but there was a big thing about 20 years ago, I think, of kids having dummies, which as an acupuncturist, I think, ooh. But what's too much? Of course, children, we don't, you know, want kids shrieking all the time. In Chinese medicine, that would start to be like a pathology, you know, that we want to keep it like that. Free expression of childhood emotions, God knows, with the lockdown and COVID, quite where that's going to leave kids, and with a culture that's so heavy on safetyism and risk. I don't quite know where that will leave that, but anyway, that's another debate. Falls and traumas. So an acupuncturist will always ask, you know, have you ever, if you come with migraine in your 20s, we would ask, have you had car accident, whiplash, anything like that? May be relevant, and it may be not. It's that web of weaving that web. I think attitudes and emotional patterns are a really interesting one, that obviously how we're brought up, what sort of emotions we also pick up from our parents. You've got a very angry dad or an angry mum, what does that do? You know, or does it have the reverse effect? I don't know. But these are the kind of questions that would be interesting. You know, what's the balance? Now it seems to have shifted ways into the safety, particularly, you know, after Tuesday's heat wave. I mean, life is not risk-free. We know that. We need some risk. We've been, you know, I feel very lucky There wasn't a panic and a sense of alert all the time. How does this affect us? And, you know, I always say that any society actually creates its own disease at the time with all the different things that are impacting. So, you know, what is it about our society at the moment? Well, risk and safetyism is very important, so there may be consequences to that. Who knows? It may go the other way. I don't know. But it's an interesting one. Watersheds are recognized in Chinese disease causation, puberty, childbirth, menopause, and I wanted to say just a word about that and about women's health. And I just want to apologize to the men in the audience here because, you know, in these days of, you know, sort of political correctness, I'm terribly aware that we focus on women's health and menopause. But, you know, for me, the fact is that women have these whole extra systems, you know, that are pretty busy through life. So, of course, there's going to be more to go wrong. I do want to say, because I've been really sort of sad to hear the media, particularly over the last 6 months, you know, suggest once again that the only way to deal with menopause is to take HRT and that it is, you know, something that needs medicalization. That was not the case and is not the case in China. In China, women call it the second spring. And they welcome it because it's a time when the body stops all this massive cellular change every month. And if you think now, and I always think, and I say it over and over to patients in clinic, you know, we're living longer, but the human body hasn't actually changed. And for most women here, we don't have to go that far back, maybe 100 years, you know, or even less than that. We'd have been pregnant, you know, from between 14 and 40. If you think about that, we wouldn't have had all these monthly periods. And not all those pregnancies would have made it, of course. It would have been one after the other. You might only have had 3 or 4 live births. Not only that, but, you know, breastfeeding obviously was done for longer. And, of course, we'd all be dead and finished by the time we were 50. But, you know, the point is that this has really changed now, that young women today are having lots and lots of periods. We've also medicalized that. And, you know, the pill is a brilliant contraceptive. And, you know, I have no doubt that it has adverse effects on the body. I think I used to say I didn't know about that, but I've seen enough now over almost 40 years of practice that, you know, there is a cost to pay for that. We have a huge number of women come into the clinic with fertility problems, for which acupuncture's now got a bit of a reputation, and that's another story. But I worry about young girls and their health because they're doing so much as well. You know, it's great on the one hand. I mean, we've got that freedom, but on the other hand, you know, it has to be worked out and worked through. How do you stay sane and how do you stay well? And I'm well aware that in China, of course, you know, the menopause was a time to look forward to because, of course, politics were back to that. They had a one-child policy. Their fertility was a disaster because the consequences of having more than one child meant that, you know, there would be heavy fines and forced abortions and all the rest of it. So I do realize that there's a cultural difference there. But nonetheless, and I can say it myself, I think it's fantastic being plus 60. You can get rid of all of that. And you can stay perfectly well without necessarily needing HRT. But it's okay. I mean, I've certainly seen women. I would just argue that it's a fairly small percentage who really benefit from HRT. So, you know, as with any drug, I mean, we wouldn't be without them. But on the other hand, this attitude that we all need to take them whatever is troubling to me. But very good for the drug companies, of course. So, okay, so the traditional Chinese view of the causes of disease. So they divided it up into exterior factors of which, you know, and again, you have to go back to a very old society that didn't have, you know, air con and everything around them. So, you know, wind was seen, Chinese word is feng, and there's an acupuncture point actually just at the back of the head here, which is called feng shui, and it means city of wind or place of wind. And this is the first acupuncture point you would use in a cold, because a cold, for example, and even COVID for that matter, would be seen as being driven in by the wind. And this is the first place. And you know, when I learned this, actually, and I saw in China the fact that if anyone got a cold, which I can tell you, we always got colds in China, no wonder COVID came from there, was always the thing that Westerners got, you know. And the Chinese would get these glass cups out, and they'd create a heat in them, and then what they do is put them into the back of the shoulders and start scraping, and it really hurt. But the idea was you're trying to draw something out. So that's the idea of wind. Now, wind often combines with things. Wind cold, which would be like your common cold, or wind heat. The symptoms of wind heat would be things like sore throat, starting to feel fever. The minute you feel that, you know that this thing from the outside is beginning to penetrate. So that's your wind heat is very much your BA5, which is the current COVID variant that's around. So, you know, it's the sore throat. It's actually mild, thank goodness. Now, this is a really interesting one. When I used to do lectures on summer heat, I always used to sit here with a British audience and say, well, we don't really know this one, unless you've been living out in the Middle East. Well, I kind of think we did last week, and certainly we had 39.5 in Saffron Walden, which did feel like the desert. It felt like really was too much. But anyway, it was a good example of summer heat, and I think most of us found we could suddenly get really tired. I took a siesta with a fan. Now, interestingly, you see these all combined together. The next one is damp. And damp is, if we go back again, when the Chinese were were dealing with their rice in paddy fields, they were up to their waist, usually in water. And so some of the first diseases they got were arthritic, which we call B syndrome. So we don't see arthritis as entirely internal. It comes from the outside, and it's usually damp and hot. So a red arthritic knee would what we would call damp heat. And that damp heat actually then depends. Remember what we said in the first slide. It depends what your internal constitution is like as to how bad that heat's going to be. So, and droughts, which, again, we really don't see much of here, but that's really drying conditions. The Chinese also identified 7 emotions, and I always found this extraordinary because one of the problems in China of living there in the early days was that the language, if you put emotion into what you say, which I do quite frequently, you change the meaning of the word. So if anyone in the audience has ever studied Chinese, if you go ma, you've just called your mother a horse because it's actually ma, which is mother. So, you know, there's no emotion in the language in the same way, which is really interesting. And not only that, when, of course, my mode of transport in 1990 in China was, of course, a bicycle. And this was serious business biking in China. This was not like my old bike as a kid with a bell on it that I never used. This was a bell I used all the time in China. But I parked it one day outside the only Western hotel, which was a bit like my Mecca, because it was the only place they had some vaguely clean, warm water. So I used to go there. I joined the gym in order just to use their sauna. And I left my bike outside. And when I came back, it had been clamped. And there were a whole load of Chinese around to see this Westerner, of which, with blonde hair, you know, of which there weren't many, actually face a renminbi fine to have my bike unclamped. Boy, I got angry because I had to be back at the hospital. And actually, do you know, the Chinese people walked off at that point. And so you don't do emotions. But yet, here they are in the understanding of their traditional medicine. And so anger, it's good to be angry sometimes and release those feelings, but not too much. And we all know as we get older, you actually can't get angry because you feel pretty crap afterwards. You get a headache, or you have to go and lie down, or even worse, you have a heart attack. You know? So, the Chinese always said the organ anger affected was the liver. And in traditional Chinese medicine, the liver keeps everything in our bodies moving nicely. And when we get angry, it stops that nice movement, which is why we feel better when we take exercise. Now, this is a really interesting one. We'd all think excitement and joy would be really positive, and it resides in the heart in Chinese medicine. But too much excitement or too much joy is seen to dissipate qi in Chinese medicine and is not good for us. And again, you know, the classic would be winning the lottery and getting so overexcited that you sort of blow a fuse. And a lot of drug use, so things like cannabis and LSD and those kind of things really would fall under that category. Sorrow is a really interesting one, and in very traditional medicine there are all sorts of interesting acupuncture points that are on the lung channel, which runs up here. And they were called ghost points if we translate them, and the idea was that when someone dies, we may get some of their chi back, but we don't want too much of it. That was seen as being pathology. And of course, all this very interesting side of Chinese medicine, Mao got rid of all of this in the Cultural Revolution. And I know when we've taught acupuncture, I used to do a lecture called Things That Go Bump in the Night, which I kind of think I might have been able to do here, actually. But it's really interesting. It's about déjà vu and acupuncture points and so on. And I did once have a patient in the 90s in clinic who was a woman I'd seen for, I think, neck pain. Lovely woman in her late 70s. And she came back to me when her husband died because she'd had flu and pneumonia and hadn't really recovered. She had very tight chest. And, you know, for some reason I thought, you know, there's something about this death. He's still here with her, and it's not in a good way. I don't know what the hell I was on about, you know, but I just thought it in my head. And I just said to her, as I have the freedom to do as an acupuncturist, which is where we're so lucky as opposed to, so we have the time as well. I said, where is your husband? You know what she said to me? She said, oh, he's in the room with us. And so, do you know what? I thought, right, I'm going to use that ghost point. It's called Luicha in Chinese. It's lung 7. And I used that point. Anyway, she got better. I don't know if it's a coincidence, but anyway, she got better. So it was seen as really important to be able to grieve in Chinese medicine, but not too much. There needs to be that point where you can let go and move on. Now, fear and fright both hang out in the kidneys in Chinese medicine, and there's a difference between them that I see in clinical pictures very often. Fear is deep stuff. And it's the kidneys. It's the kind of stuff, if we have something really traumatic, that we feel changes us in some way. And I would argue a bit that over COVID, and some of those media images that came out, you know, of people in suits was so fear-making. They really were. And I don't, in any way, I want to make this very clear. COVID is a bugger. I'm sorry for swearing. It's a nasty respiratory disease. I in no way deny its existence. But the fear. I mean, one thing as a medic, and I'm leaping a bit ahead now, is that, you know, the general rule in medicine is let's not panic unless we have to. I mean, obviously, if it's a road accident or a heart attack, you've got to move fast, and thank God for emergency medicine, because we wouldn't be here. You know, I broke my shoulder in Italy, and I'd love to have said it was in the snow. Actually, it was in the mud, and you know, when I turned up at the emergency ward in Italy, I looked like I'd been here at a Glastonbury Mud Festival, actually, not up in all the nice sort of Italian resorts. But thank God, you know, the gorgeous Italian surgeon said, well, he said, either, you know, I look after you tonight or you lose the use of your left limb. Thank God for him. He was gorgeous looking, by the way, and all very lovely Italian stuff. And I have 100% use of my shoulders. So I want to make it very clear, I would not be without emergency medicine. But we are never in a good place, even with something like cancer, to be acting with too much fear. Because the way that we make decisions in medicine is really important. And this doesn't matter whether it's acupuncture or whether it's you know, conventional surgery. We want to get all the information about what's wrong with us. And we do want to look at the evidence. But then, you know, there's a wonderful book called How Doctors Think by Kathleen Montgomery. It's a wonderful read. She's a Harvard scientist. She's a Harvard physicist. Can't remember what she does, but anyway. And she said she was a very gung-ho surgeon until her daughter got cancer. And then she realized her daughter got breast cancer, that she needed a different viewpoint. And she concludes that as medics, we get the information which comes from whether it's acupuncture or surgery or physiotherapy, whatever it is we do, That's our information and our expertise. Evidence is useful. We look at how things do. We look at trials. But the third thing she identifies is we need to have a hunch or an intuition, because that's that grey area of medicine where we don't really know always the answer. So we have to get back to something deep here. And if we panic, and that for me was one of the issues about COVID, was that the media and the government particularly went down the panic route. And so, there was a lot of panic about, which didn't even seem, and we have a dog. So we won't panic. So anyway, fear is deep stuff, and it does damage in Chinese medicine. But that's really different from the notion of fright. And fright is that things that go bump in the night. It's that real, you know what I mean, that sort of feeling jittery all the time. And I had a patient who rung up just a couple of weeks ago and said, I really haven't been feeling well, and I feel anxious all the time and switched on all the time. I cannot switch off. And she said, I just can't put my finger on it. I just feel frightened. It's not deep, she said, it's something superficial. So already Chinese medicine has something to offer, because we recognize that category. And that can manifest in things like insomnia, palpitations, sort of it's very much the heart. And when it's real fear, it relates back to the kidneys, and traditionally they have an interplay together. This next one is really interesting. Brooding is quite a difficult concept from Chinese to translate. That's about as close as we get it. Brooding is overthinking, sometimes described as over-contemplation. So that's a really different, that's a different sort of feeling, and that relates to the spleen. It's not to overthink too much. And do you know that feeling? You've got some problem to resolve. It's the end of the day, it's getting late, and you keep thinking it out, and it goes round and round and round and round. And actually, it'll keep you awake. Better just to stop it with distraction. So that is really important. Anyway, I'd just quite like a time check, if I may. Just. Thanks, that's great. Yeah, lovely. Didn't quite, we don't need 10 minutes for that, so yeah. So the other things, just to say a moment about, are, of course, traumas are terribly important. We all respond differently to trauma, whether it's emotional or physical, and it depends, again, on our levels of strength. Parasites and poisons is another one which traditionally was more common than it is now. I always thought wrong treatment was a really interesting one, because the other thing that of course I notice so much about health today is we are living longer, and on the one hand that's good, but on the other hand I sometimes think as a society we have not had a conversation about the implications of that. And any of us with aging parents who are well into their 90s and the dementia and all the rest of it, it creates a new set of issues that we have to deal with, which is how we're going to look after this. I'm not sure. I think care homes doing an absolutely fabulous job, especially having had experience, but I'm not sure as a society we've quite got our heads around this. And of course, back to the Jeremy Hunt show, one of the reasons that there are a lot of admissions into A&E at the moment is because people are taking a lot of drugs. I mean, I sometimes have patients who'll put down a prescription. They don't even know what half it is. There's 15 products on there. And the problem is that even in care homes, people are having, medical emergencies that are so complex now that they need proper medical care because care homes can't provide it. So you're the first person ever to introduce this term, iatrogenic, and there's a very good book. Again, I'm giving you lots of old references here. 1976, Ivan Illich. He was a sociologist who suggested that industrialized societies impaired the quality of life with too much medicine. So that's a really interesting one to think about. And my goodness, here is the last one that was on my list, and these ideas go ways back. The last one was epidemic pestilence. And here's the heading, strong Mass contagion, ominous disease picture, rapid alteration, and we know with that first horrible alpha and delta in COVID how quickly it went through the body. It was an absolute vump, so it really fitted, often seasonal, and of course COVID was that to a degree, although that's shifted with obviously a higher rate back through this summer. Yeah, so I think that was really getting towards the end of really what I wanted to say about the causes of Chinese medicine. I've got pages of notes here. I don't want to say really, we haven't got time if I'm going to just allow that 10 minutes for the any questions anyone has got. COVID, I mean, as I say, huge uncertainty. It affected all of us in all sorts of ways, and it was a novel virus. I had it back in May, actually. We got it on a holiday in Cornwall. Thank God it was a mild strain, and it reminded me, actually, of the kind of stuff I had when I was a kid. My mum used to say, 3 days coming, 3 days here, and 3 days going. I'm not a very good candidate because I have the wonderful advantage of using acupuncture and Chinese herbs, but I'm jolly pleased never had it earlier. I'm going to be blunt. I think the lockdown that continued to young, healthy people was probably a big mistake, and the evidence is starting to come out of that now. Sweden's got some very interesting stacks. I worry that the scientific debate during that time was very one-sided. Any scientists who had other views, such as Gupta, who's the leading epidemiologist from Oxford, who advised not to lock down, everything she says seems to have come to pass. And I worry, my understanding coming from an arts background into science is that there should always be a debate of two sides that reaches consensus. And I think the big mistake, sadly, here in Britain was that COVID was political, you know, and became a tool of governments. I have to say I hated what happened over vaccines. I'm not an anti-vaxxer. I think they save lives. I wouldn't go to a cholera zone without a cholera jab. But I really worry about the way in which there was a threat to body autonomy, because as a medic, I think if you take away people's body autonomy, you, as my mum again used to say, you make a rod for your own back, because the state can't possibly look after the consequences, and it is a slippery slope. You know, as we see in the States with the abortion arguments, you take body autonomy away, you take away a big bit of freedom. I didn't like the way people who chose not to be vaccinated were othered in that way, and I have a Canadian husband, actually, and in fact in Canada it was all more draconian, that you can't even go there without being vaccinated. So I don't like what happened. I have no problem with people getting vaccinated. COVID is horrid, but at the same time, you know, I don't like what went on through that. And it comes partly from having lived in China. I've seen the effects of a cybersecurity state, which it is now, and we sure don't want that here. Anyway, acupuncture is making great forward movements now. So we knew, you know, the Chinese knew at these times that 3,000 years ago, if you put a needle here into the acupuncture point in Neguan, pericardium 6, you'd stop people feeling sick. And there's now over 300 studies that show that part of the brain lights up, which controls nausea and vomiting. So we really have the evidence for how it works, which is fantastic. And I just say to people, you may well have been a lot of people who've tried acupuncture. It isn't as powerful as Western drugs. It doesn't work as quickly, but what it does, and here I go again, it brings back that equilibrium. And it was not the life journey I expected, but I am so lucky. It's given me an incredible life. It is a fabulous medicine. And if you have ever or want ever to try it, I recommend. But just find a good acupuncturist, that's important. It needs to be ideally someone from the British Acupuncture Council. So if we've got a very short time, if there are any questions, please. Can't see you very well, but if anyone wants to, I can see one there and one there. Sorry.
It will be a very short time. I have to warn you, so yes. Here we go. Bear with me.
I just find something really fascinating about this model that you're presenting, traditional Chinese medicine as such, and acupuncture. There's one thing that you haven't mentioned, which I think is incredibly important, and that's nutrition.
Yeah. Thank you. And that's a really good point, because actually I think the point you make is a really important one, because traditional Chinese medicine isn't just acupuncture. It's Chinese herbal medicine. It's movement and exercise. It's Tai Chi and Qigong. And it's absolutely dietary therapy. Yes, bang on. Thank you for that. That's really important. You'll never catch an acupuncturist with ice cubes in a drink. You get dirty fingers or sitting under air conditioning. Yeah, thank you. Yeah.
How would you treat somebody with acupuncture who has got a problem caused by the COVID vaccine? Can you still treat them?
Yes, we can. Absolutely, we can. We've seen lots since the beginning of the year. And do you know what? The COVID vax stuff is often very, very similar to COVID. It's interesting. It seems to get hooked up in what we call the gallbladder channel. We've had lots of people with tinnitus. We've had lots of phlegmy conditions. Yes, we can. And we've had all sorts of stuff through the clinic. And the answer is very positive. And you know what? Those side effects seem to wear off. So in the end, it's the same with COVID and long COVID. Yes. Bang on. Yeah. Yeah, there's a gentleman here.
This will have to be the very last one, I think.
Yeah. Maybe we can do two. Very quick. And then we'll do the quick.
Thank you very much. Do you think sitting in a breeze can cause neck ache?
God, if you were in China, they would say yes. They would physically get up and move you or shut the window or turn off the air conditioning. I think it's not the only factor, but I think it can contribute. Remember, it's how is our internal situation versus our external one. Yes. I think it has to be the last one. I'm so sorry to anyone else. Yeah.
Are they studying, or do you see any long-term effects of the COVID vax? What is down there, deep down, and long-term effects, especially of the vax? I know.
Do you know, I don't know. It's probably my own honest answer. But do you know what? Let's stay positive. Just get the thing out your system. The current vaccines seem not to be adapted anyway for BA5. You may well know there's a guy called John Powell on YouTube. I think he's one of Britain's oldest nurse educators. He's very good on this, actually. And the HART group, H-A-R-T, that you might know, they are following this stuff up. So, but we're tough. We can deal with it, is my message. You know, absolutely. All right, thank you very much. It's been a lovely audience. Thank you. Thank you.